much for coming. I am so thrilled to have you here. This is Dr. Shekhar Saxena. He is right now with Harvard. You took a new position at the Harvard Practice of Global Mental Health, and then at the Harvard T.H. Chan School of Public Health. I've known you for quite a while through your work at the World Health Organization, where you were for 20 years heading up the mental health and substance abuse. And you've been an editor at the Lancet. Let me just get that right. You've authored more than 300 scientific papers. You're an editor on the Lancet Series of Global Mental Health, and then the Lancet Commission on Global Mental Health and Sustainable Development Goals. You have been a leader in the mental health space for so long, and it's just such an honor and pleasure to have you here. And we know that mental health is key to overall global happiness, and so important to shed light on the issue, and more importantly, give the solutions that we have to the public globally on mental health, because it's definitely addressable. So we're really grateful to have you here and talk about just kind of the overall landscape of global mental health and what people can do to address global mental health in their communities. So thank you so much.
Thank you very much, Catherine, for inviting me and the entire Agora team. I am so pleased to be able to join the World Happiness Agora and present a few thoughts, maybe even a few facts and figures about why mental health is so important for us, has been important in the past, is important in the present, and more so, why and how it should be more important for the future of the mankind and for all of us. Mental health is a very interesting area, and it's an area of health, but it's also an area for the entire development, for the humanity, for the society. So it has many, many dimensions, and I'll just be able to present a few of them. So let's begin the journey and see where we are with mental health right now and what we can do in future to make it much better for all of us. I am very keen to show you the WHO's definition of health, which is much more than illness. It's the World Health Organization and not the World Illness Organization. So it defined in 1948 health as a state of physical, mental, and social well-being, and not merely the absence of disease, which in a few words really summarizes what health is and how mental health is an integral part of this concept of health. And it was said so many years back, is equally true now compared to what it was said to begin with. But again, in 1978, in a very famous conference organized in Alma-Ata, it was very strongly reaffirmed that mental well-being and social well-being are important. But another very important statement was made that health is a fundamental human right. And we really need to see this as a human right. It's not a luxury. It's not an option. It's a fundamental human right for all of us. And we ourselves, as well as our societies and countries, need to respect that right. And mental health is an integral part of that right. More recently, in 2015, all the world leaders collected together and adopted the 2030 Agenda for Sustainable Development. And for the first time, at such a high gathering, a very large political commitment was made for sustainable development, and promoting mental health and well-being was a part of that. So this is the highest level that you can reach, and mental health has reached that. So politically, there is a very strong commitment for mental health and well-being, and happiness is part of that agenda. So I think we are reaching a point where at least there is enough attention, although, as I will show very shortly, there is perhaps not enough action. Mental health is described by WHO in these words, which essentially puts it as a kind of unique quality of human being, where They are able to cope with normal stress, can realize the ambitions that they have, and can work towards themselves as well as towards society. And their contribution is the satisfaction that one gets as a part of mental health. Let's go from mental health to mental disorders. We know that all of us should have some quality of mental health, but some of us have a mental health problem, and sometimes it does become a mental disorder. The health and disability case for mental disorder is actually very, very strong. It influences, it affects a number of us. The numbers are large and increasing. There is also a very large amount of disability associated with mental disorders. Also, a very large number of deaths are there because of that. And in spite of all of that, the treatment gap, that means the number of people who do not get treatment when they deserve that, is very large. So these are some of the things that are extremely important when we talk about mental health and happiness. Just look at the numbers. The numbers are very large. There are many people, millions of people, and see the figure for depression. More than 300 million people all over the world suffer from depression. And similarly, for many other common conditions, the numbers are very high. And the last column here shows that the numbers are actually increasing. So an increasing number of people, as well as increasing proportion of people in the world, are having some kind of mental health issue, and many of them are clear mental disorders. And they cause a large amount of disability. Almost 1/4 of all disability because of health condition is because of mental behavior or neurological disorder, which is a very high proportion. And a large amount of this burden and disability is actually during young ages. If you look at this chart, it peaks within the youth. It peaks between the ages of 15 and 35. So it's at that age where a person should be receiving education, a person should be working and contributing to the society's welfare and economy, is actually getting affected by mental disorders. So this is a huge crisis and is increasing. It also causes deaths. There is one death every 40 seconds because of suicide, and a very large number of these deaths are in young people and are because of mental health problems. These deaths, incidentally, are more than all the deaths because of conflicts and disasters about which we hear every day in TV, in newspapers, and everywhere, but not so much being talked about because of suicide. And these are issues that are very prominent in our society, and sometimes suicide has been called a silent epidemic because people are dying. More than 800,000 people die every year, and still we don't talk enough about it. This is one of those things that we should be talking much more about and preventing by taking measures which can prevent suicides and suicidal attempts. Also, people with severe mental disorders suffer a variety of issues apart from suicide, and they actually die 15 to 20 years earlier than other people because of common conditions like heart illness, like obesity, like lack of nutrition, and even by cancers because they're not diagnosed early enough and treated. Next, let's look at the economic burden of mental disorders, which is extremely high. It is not realized very often by many of us. The figures are not in millions, not in billions. They are actually in trillions of dollars every year. And these figures, there are so many zeros that one loses count of them. But the numbers are really, really very high. Societies and countries are losing a lot of money because they don't look after the mental health of its citizens well enough. These cost estimates are for direct as well as indirect costs. And in some cases, the indirect costs because of people not working are much higher than the direct cost of treatment. It's not only about disability, it's not only about money, it's a human rights issue. People with mental disorders are at the receiving extreme end of human rights abuses in almost all countries. And these are issues that we can no longer ignore. It's happening in low and middle income countries, but it's also happening in high income countries. It is truly a global issue. Whether there are people who are incarcerated in a low income country in mental hospitals or incarcerated in prisons in high income countries, their life is exactly the same, and they suffer for no fault of theirs. So those are issues that we need to keep very high in our mind. And this is about future. It's also about wars, conflicts, and natural disasters, which are affecting a very large number of people amongst us. And these put an added amount of stress on people who sometimes lose everything, their family members, they lose their homes, they lose all their possessions, and they have to migrate. And this causes stress, but it also causes a higher prevalence of mental disorders. There are more than 65 million displaced people in the world, and all of these people are at very high risk to unhappiness, distress, and in many cases, clear mental illnesses. And a high proportion of these people are actually children. Their whole life could be changed because of the fact that they have been forcibly migrating. They lose education, they lose the chances of having employment, sometimes they lose their family, and this affects them mentally and socially in an extremely severe manner. In spite of these facts, which are clear, the treatment that the societies are providing for management of mental disorders is extremely poor. Even in high-income countries, more than half the people do not receive adequate treatment for a common condition like depression. And in low and middle-income countries, the proportions are very high. 50% people don't receive any treatment, and in high-income countries, it's only a quarter of people who receive at least a minimally effective treatment. This is how we are treating people who have mental disorders. If you had the same figures for cancer or for other conditions, the world will be much more shocked. But this doesn't happen somehow for mental disorders. And the reason for that is that the expenditure on mental health care is extremely small. If you look at this chart, the disability is high, and the expenditure which countries make from their own budgets is extremely small. There is a large gap in the burden and in the budget that people spend on that. That's why some of us keep saying, when it comes to mental health, all countries are developing countries. None of them have got it right. It's not a problem of low and middle income countries. High income countries are treating mental health still as a subject that is often ignored. The Lancet Commission, Catherine, which you referred to earlier in the introduction, is actually a very clear path for a rethinking about mental health. It gives the concept of mental health as a dimension, which is extremely important. We cannot divide the world into two groups of people, one who have mental disorders and another who do not have. In fact, mental health should be recognized as a unique attribute of all of us, and it has dimensions which are about positive mental health, which we should all have, mental distress, mental disorder, and some of us will have psychosocial disabilities because of that. So all of us are at some stage in our life within the dimension of mental health having poor or better mental health, and something can be done about all of us. We can improve our mental health, we can prevent a future mental disorder, and if somehow we have a disorder, we can certainly take care of it by things that we can do ourselves, but also by things professionals can do, and we can reduce the psychosocial disability that is associated with mental disorders. So mental health must be looked at as a dimension and not as a binary function of people having mental disorders and other people who don't have. You might ask, what is the relationship between happiness and mental health and mental illness? There are very clear figures available now to say that mental illness as a community-wide phenomenon is very much responsible for poor life satisfaction and misery at least amongst adults in a number of countries. This chart is a little bit complicated, but if you look at the row which says mental illness, a large amount of variability on life satisfaction and misery is associated with the presence or absence of mental illness. So this very clearly posits mental illness as a community-wide phenomenon within the domain of happiness. If a society is unhappy, a large amount of that unhappiness is actually because of mental illness at present or might occur in the future, so we can do something about preventing it. Also, inequality at a society level gives rise to health and social problems. If a society and country is more unequal, it has more health and social problems. And this chart shows you that if you divide the countries between those which have large amount of inequality versus those which have less amount, there are many things which are different between these countries. And one of them is mental illness and drug and alcohol addiction, which is much higher in those countries which have a large amount of inequality versus others which have a less amount of inequality. So mental health, mental illness, as well as happiness is so much determined by social events and social phenomenon, one of them being inequality within society. I painted perhaps a negative picture. We are not looking after our mental health very well. We are not doing enough for that. We are not spending enough money. We are not giving enough attention. But are there any things which have opportunities for future of mental health? And are there things that we can be excited about? Are things becoming better? And my answer is yes. We have a lot of mileage to cover. We have a lot of distance to walk, but we are walking. There is certainly an increased awareness amongst public and private sources, also increased investments in that, which is slow, but is happening. There is also a focus on young people, and mental health of young people is extremely important. So that has to be really focused on by all societies. There is increased use of evidence-based interventions. There is a need for integrating mental health within the overall healthcare system, integrating with the emergency response because of conflicts, wars, or other disasters. And there is need for focusing on stigma reduction and involvement of communities. And when I say involvement of communities, I include everybody, you and I, but also people who have a mental health problem. In fact, they are the people who are going to carry the torch forward in a much better way. And because of a stigma, sometimes they don't come forward, but increasingly they're coming forward. And you might have heard about many celebrities, sports people, actors, actresses, and even politicians sometimes, although who are a little bit still very hesitant. They're coming out now to say, yes, they have a mental disorder or mental health problem themselves or within their families. And these are the things which can actually guide us in the future to have more attention, more resources, and finally, more solutions to mental health problem. So let's say health for all and mental health for all. Thank you very much.
Thank you so much for that. That's Dr. Saxena. That was amazing. And I think so important and a really good tone to start the day, because I think if we do want to address happiness really at a systemic level, we need to address where a lot of the unhappiness comes from, which a lot of it is stemming from mental health. So we have a great day full of incredible speakers, many of them you know that we've worked through the years, that are going to really provide solutions for what we're doing to address this in the field and what solutions actually exist. Because, you know, as you said, there are a lot of things happening. Youth are driving change, which that's how we're ending the day. I mean, we believe the future is youth, but I think it's really done a great job of just giving the need to address the mental health if we want to really create a happier and healthier society.
Yes, and if I wanted to ask him a question, Catherine?
Yeah.
Yeah, thank you, Dr. Saxena. That was a great presentation and a strong case for how severe the problem is and a lot of the things that are being done about it. So my question to you was, what is the one thing or more than one thing that brings you most hope about the future of mental health?
Thank you very much. That's a very nice question, and partly I have covered it earlier. The thing which gives me the maximum hope is not the involvement of professionals, it's the involvement of people themselves. Mm. When communities get involved, when it becomes an issue for the whole society, and especially those people who are at risk for mental health problems or actually have mental health problems, when they come forward and affect and shape the policy, they demand more rights, they demand more care, they demand more protection. That's when things start happening, and I see that happening. So it's the people who should get involved themselves, including the people who have mental disorder, which gives me the maximum hope. The second hope that I have is from technological advances. We know that a lot of people now have access to technology. The number of mobile phones in this world is now almost approaching the number of people in this world. And those are the issues which can actually help us to provide care for people who do not have any. And technology can actually solve some problems. I'm not saying at all that technology can solve all problems, but it can certainly facilitate, especially because there is so much dearth of professionals who look after mental health. And sometimes technology can amplify, can enlarge, can multiply the effects that one can get. So technology can be harmful, that is very clear, but it can certainly be very helpful for our mental health and happiness.
Thank you.
Yeah, I think that's wonderful. And that, through your leadership at the World Health Organization, you've done a really wonderful job of engaging with people with lived experience. I've definitely seen a big shift in the space globally. So I want to thank you for your leadership in that. And I totally agree on technology when we look at the 50% treatment gap and the amount of professionals we have to serve the population. And you're talking about depression of over 300 million people. It's hard to reach. I mean, we can't reach that many people with the number of professionals we have. So coming up with innovative ways for technology to reach the global population, I agree, is really important. So yeah, amazing points, and thank you so much. I know you're so busy and traveling all over the world extensively, so for you to take out the time, it means a lot to me, and I think getting your message to the broader audience is so important. I admire you and all your work so much.
Thank you very much, Catherine, for inviting me. It has been a pleasure to join.